All right. Welcome, everybody, to the Health Babes podcast.
Yes, welcome.
Oh my gosh.
If you only knew what we went through today.
Not an IT expert by any means.
Yes.
None of us are.
So for those of you who don't know who Dr. Kelly Blodgett is, he's the founder and owner of Blodgett Dental Care in Portland, Oregon. And he's been practicing for over 28 years. He's passionate about respecting the autonomy of his patients and educating his followers on the many options they have in dentistry. So thank you so much for coming on. I'm really pumped to have you here. We have so much questions.
Oh, thank you.
Yes.
I'm thrilled to be with you. This is just great. I know it's taken us a while to connect, so
I
I'm
know.
looking forward to it.
I actually heard of you through Dr. Jess with all your work, and then started following you on Instagram, and you're doing a lot of amazing things. So thank you for coming on.
Oh, absolutely. It's my pleasure.
Yeah.
Let's talk about biological dentistry, because I don't think a lot of people even know what that is. So can you tell us, what does it look like for a patient that comes to your practice as a biological dentist versus someone who would be a non-biological dentist?
Sure. So I would say that the concept behind it is really that we want to understand root causes and truly prevent disease states. So as opposed to kind of, but if you think about your traditional experience in the dental practice, you come in, take x-rays, poke at teeth, you're looking for holes, and then your treatment plan looks like, here's where we want to drill and fill. And the same would be true if it's a periodontal issue a lot of the times. Whereas we want to understand what's going on with, the oral microbiome. Let's talk about your nutrition. Let's talk about your GI health. Let's talk about how you detox, things of that nature, so that we can truly prevent symptoms from occurring in the first place in the mouth, right? Because once you cut into teeth, you're kind of doomed to treatment, future treatment on those teeth once you've damaged them. So that's part of it. And then another part of it is looking at the issues. I'm trying to be cautious in how I state this, but a lot of the traditional techniques in dentistry, things that have given it a bad name and created a very negative stereotype, from the mercury fillings to the root canals to the painful extractions, all these kinds of things, they oftentimes can lead to worsened systemic health for that individual. And so part of the goal in our practice is to look at what kind of care has been provided for that person and what could be causing either infection, chronic states of infection, and or energetic imbalance in their mouth, and how can we rebalance that for them and create a better state of balanced health. So it's more of a whole body, whole energetic being perspective than being tooth focused.
Right. Let's dive into, there's so many opinions of different treatments, right? So let's start with root canals. I want to hear your opinion on how you handle root canals in the practice. Let's start there, and then we'll get into some other things too.
You bet. And I apologize if I go on. Please stop me if it's too much, because it's something that I talk about more than anything.
Mm-hmm.
And part of that is because, when I was a dental student, you just kind of take, it's like gospel, whatever they tell you to do. It's like, okay, right. Well, we kill teeth, right? My favorite is, here's a tooth that maybe it has a cavity. You drill it, you fill it. It's sensitive afterwards for a lot of reasons, which would be normal. And then the solution is, well, you must need a root canal, right? Mm-hmm. Let's lobotomize your tooth and turn it into a zombie tooth. And then wonder why your body feels different, right? So anyway, the thing that I try to share with our patients is understanding that when you remove vital connection to any body part, that is in essence no longer a part of you. We wouldn't do what we do to teeth with root canals to any other body part, yet we allow it because we're so focused on the idea of keeping a tooth at all costs for most dentists, right, that we do this, right? We remove the vital components clean it out as best as we can, stuff some material into that canal system, and then just, pray everything becomes asymptomatic. It won't ever be healthy again, but it'll be asymptomatic. So the problem is that the entirety of the root system to that tooth is porous like a sponge. Your enamel at the top is not, of course, right? That's a very hard, highly mineralized, acid-resistant barrier. But usually at the gum line and below, which is about 3 millimeters until you hit the bone connection, that whole space is just massively porous, tens of thousands of tubules into which microbes can invade the tooth and do. And so over time, the tooth, and what I mean by time, like maybe within a month's time or so after a root canal, what they have found is that the entirety of the root system becomes teeming with microbes from viruses, parasites, bacteria, fungi, whatever's in the mouth. It has the ability to crawl inside of the tooth. So the reason I explain that is that when you look at the anatomy of a tooth, which curiously enough, all of us dentists learned in dental school, we should appreciate the nature of how that is a flawed procedure. And I'm not here to say that root canals are horrible and that nobody should ever have one. I don't believe in black and white thinking like that.
Right.
There are absolutely cases where when you're in a bad situation, sometimes that's the best solution that person can choose given their set of circumstances, their health goals, their state of health, and maybe even their budget. So sometimes it's a good solution relative to the circumstances. Is it a optimally healthy solution? Absolutely not. Mm-hmm. So the idea, I mean, when I see people who say, gosh, I just paid, $3,000 to have this root canal and crown put on my tooth, why is it still hurting?
Yeah.
It's only been a year. And so when we explain to them how this doesn't work long term, oftentimes what they share with us is, geez, I wish I had known that when I was told I needed a root canal, right? It's an oddity of informed consent in this day and age. We're so focused on informed consent, yet when people have painful teeth, they're told you need a root canal.
Right.
They aren't even given other options most of the time. And I'm not saying like all dentists don't do that, but that is vernacular we have all heard. Like, you need a root canal, you need a filling. No, you're not given any other options, right? Mm-hmm. So I think it creates an opportunity for us to consider, are we doing the best service to the patient that we can? Are we offering all of the options, right? Because I want for my patients to be able to choose based on their own goals and values, not mine.
Yeah. Yeah. And, we see a lot of patients too, a lot of fear with it too. So, I'm sure you see this in the practice. So many patients come to you and they're like, oh my goodness, I have 5 root canals in my mouth. So what are my next steps to make sure this isn't causing issues in my body? And how do I know if I'm a good candidate to get these out? So what's your process with that? Because there's so many people dealing with this.
Yeah. I mean, to the tune literally of millions.
Yeah.
Right? I mean, 15 to 20 million root canals done every year in the United States alone. That is obscenely more than my partner and I and every other, biological dentist who would like to help people get healthy could ever manage. How we manage that is, really gaining an understanding of their overall health to begin with, because not for everybody, certainly, but for some of our patients, they might, their symptoms might be they have chronic eczema or they have chronic GI troubles. And we have to consider, well, when we, shake things up here by removing those teeth, might they experience a Herxheimer reaction, let's say? Might their skin really break out? How are they going to detox that? And again, coming back to the importance of functional GI health, being able to, poop once or twice a day. I mean, it sounds like a silly thing for dentists to talk about based on our current experience, but in reality, when most of our patients that we see have mercury, they're taking in fluoride, they've got infection from the root canals, maybe titanium exposure, things like this. your body's trying to unload that burden every day. And if you're not pooping, you don't have a way of getting that stuff out, right?
Exactly.
So it's, we have to think of that whole picture in order to help a patient prepare themselves for the off burdening of those dead teeth in the case of root canals.
Yeah. And you're doing a lot of like 3D, you do 3D, what is it called? The scans, right? The CT.
Oh, yeah, 3D cone beam scan. It's, it's, gosh, we've had ours for 13 years now.
Yeah.
Once you start visualizing a person's three-dimensional head in 3D radiographically, I mean, we've had CT scans in medicine for, at least 2 decades now?
Yeah.
Maybe 3. This is, you can't see it in a different way, right? I couldn't go back to practicing 2-dimensionally because there's just too much information
Right.
you don't understand, and I don't want to be limited in my ability to help a person. So I think that one thing I would like to share as it relates to 3D cone beam radiography and root canals, is that, dentists, I hear this every single day. You can imagine the amount of, DMs that I get on Instagram, right?
Yes.
Like, I just saw my dentist. He either did it himself or, she sent me to a cone beam place where they did the scan and they said everything looks fine. And what they mean by that is, we're not seeing radiographic evidence of your bone melting away. Well, it's kind of like, do you want to wait until you have lung cancer to quit smoking?
Exactly.
Like, are we waiting for the symptoms? Because usually in our world, once people actually develop significant symptoms in the mouth, it's a rough day for everybody.
Right.
So we have to think along the lines of health optimization, not, minimization of symptoms, I guess.
Yeah. Yeah, for sure. And you're testing a lot of the bacteria in the mouth too, and testing the bacteria around the teeth, right?
Yeah, I mean, it depends on the patient.
Yeah.
And it depends on the other complementary health professionals that we're working with.
Right.
I work with one woman in particular who, functional nutritionist. It's really helpful for her to understand the oral microbiome and who's living there, what's predominating. I mean, gosh, we've been able to help so many people through optimal nutrition.
Right.
And getting them on fiber supplements and helping them poop and get things out.
Yeah.
Yeah, it's funny, right? Just these simple little things
Yes.
that help your body be healthier, right? But
Yeah.
to answer your question, like what a lot of people will see on my Instagram posts is when I extract teeth, whether it's been root canaled or not, for whatever reason, I'll send the root to a company called DNA Connections in Colorado and have them test for their oral panel and oftentimes also their Lyme panel. Particularly people who have been suffering from, they're given names for like diseases, like you have this disease. And it's like, well, maybe you don't have this disease. Maybe you're actually experiencing symptoms, which is a normal thing for your body to do when you have chronic infection somewhere. And so frequently it's in the mouth, and it's no fault of anybody's. It's just, we're not trained to understand that, for instance, the root canals are all loaded with microbes.
Yeah.
That it doesn't mean that every person's going to get sick that has root canals. Certainly, many people can go 50 plus years with root canals, and they are abundantly healthy and full of energy and great. They have a robust immune system. They're doing great. Some not so much. The point is, we have to consider the mouth. It's connected to the body. So
let's talk about mercury fillings, because I had mercury fillings as a kid. I had, I think, 5 put in at once. And then I had them all removed as an adult, not with a biological dentist, all at once. And I remember being so sick that day, I couldn't even get myself home. And having, ongoing issues, including thyroid issues, et cetera, from that. So I think that, it's, what do you think? Maybe under the age of 40, or I'm sorry, over the age of maybe 35, most people have had an amalgam filling.
and even today, I mean, there are still, you know, approximately half of the dentists in America are still putting them into people's mouths.
That's crazy.
So
Well,
great.
yeah, I mean, what's really crazy is that for almost 40 years, if not more, you know, there have been a band of dentists trying to get the American Dental Association to acknowledge the chronic, constant exposure that we have to mercury vapor. I mean, it's been shown over and over that the vapor comes off, you know, especially when you heat it up. You have a hot cup of coffee, some pizza,
Right.
whatever, you know, as you increase the temperature of that substance, the vapor comes off more highly. Interestingly enough, just after the start of COVID, I think it was like May of 2020, perhaps, the American Dental Association finally acknowledged, well, we will acknowledge that, you know, vapor does come off constantly. It is always a risk factor. But we only recommend that pregnant women and children under 6 shouldn't have them. Everybody else, it's okay.
Right.
And sorry, you're screwed.
There's your sign.
Yeah. But yeah, by the way, you know, start taking more soluble fiber to detox, right? I mean,
Right.
so stupid.
Yeah.
And it gets stuck in the tissues in your body and even in the brain tissue. And I know that people get like Parkinson-like symptoms from mercury in the brain tissue.
Yeah. And of course, you know, the saddest part to me is that usually the time at which people become aware of this is once they or a family member who, you know, is suffering from neurological degeneration symptoms. Then they're like, oh, you know, can we get these out? And it's like, well, you know, we can, but I mean, gosh, when you're already that far down the road, that you're having systems failure, like it's hard to detox that, right?
Yes.
Yeah.
Yes. Your body's just overloaded.
Yeah.
Well, let's talk about ozone because I think we heard you do ozone in your practice. So
Yeah.
why don't you tell us what it is and how you use it?
Sure. Yeah. Thank you. So for those who are not familiar with ozone, it is simply O2. It's medical grade oxygen, which has been energized. It becomes O3. And think of it along the lines of comparing water to hydrogen peroxide. You're adding an oxygen, is available to do oxidative chemical work. And so we use it in so many different ways in our practice. As a for example, the first way that we started using it 4 years ago when we brought it on board, we started ozonating distilled water all day long, and that is all that we run through our dental line systems. And it has been shown scientifically to be far superior to any of the chemical crap that the dental chair manufacturer will sell you this. I don't know if it's chlorhexidine or what the medicine is that you're supposed to put in this tank, but you know, you're rinsing people's mouths with that water.
Yeah.
So we decided like, how about we start using distilled water and oxygen, right? Energized oxygen. Nobody's allergic to water or oxygen that I've met yet, right? So that's where we started. And then as my understanding and the team's understanding of ozone and our training with it increased, you know, now we're doing, like, in order to help a person's body prepare for surgical interventions, we'll oftentimes do ozone injections. We can do lymphatic injections with the ozone. There are all sorts of like ozone and ozonide treatments that we can do either intranasally or have them breathe it into the lungs if it's been run through olive oil. So when the ozone goes through the oil, it chemically converts to what's called an ozonide, which you can actually breathe in, which will help with, you know, lung health. If you're suffering from anything in the lung, you can treat, you know, sinuses by doing it into the nose. And because a lot of the patients that we see who have upper root canals in the premolars and molars have sinus infections.
Yes.
All the way around those root tips, which makes sense, right? I mean, there's literally a thin Schneiderian membrane between the infection sitting around this dead tooth and the sinus floor. So a lot of times we see those areas full of gunk, and it's instead of putting them on antibiotics, which is going to blow up their gut flora and all that, you know, you can literally through the nose using a technique that we would guide a person through. Of course, it's not an at-home type of thing to try. you can put it into the nasal capsule, it floats into the maxillary sinus, and it's able to, break down that biofilm in the sinus. One thing to share is that ozone itself is tolerated very well by almost all of the tissues in the human body, except in your lungs, which is why you would have to run it through the olive oil before you breathe it, or in the eyes. So, there are a lot of safety factors, just as there are with many things we use, whether it's, high-speed handpieces, lasers, air abrasion systems. You have to understand how to use that energy effectively. But we now have 4 ozone generators in our practice. We use them all day.
That's great.
Dr. Crystal's mom has chronic sinus issues, and she actually, I think, made an appointment with you coming up, right?
Yeah.
Virtually, right?
Yeah, she's already talked with you guys virtually, so she's definitely thinking about coming out because all of her stuff happened after, the mercury fillings getting taken out wrong years ago, and I'm really excited for her to see you.
Well, thank you so much.
Yes.
But we want people to know that Dr. Kelly sees people virtually, and then you go to the practice, right? So you do like a virtual consult, right?
Yeah. And so I have, one team member, Heidi, who is our new patient coordinator. And it's wonderful. Most of our stuff is just, via email. People are able to send us Dropbox files of their cone beam scans and the photographs and other 2-dimensional x-rays that they probably have had done at other dental practices. And we're able to, through conversations, understand their goals and what they'd like to accomplish when they come out here. Something that's very unique about our practice is we dedicate one entire day a week, every single week. One day, all we do is see new patients. There are no, there's no burrs, like dental drills going on, and it's it's very calm. Each person gets 2 hours of dedicated time with our team. So it's a really special way of getting connected with other human beings so that we can understand how we can help them with their whole health through helping them with their oral health.
Absolutely. Absolutely. Can you talk about just some of your opinions on wisdom teeth extractions? I know this is a big topic,
Sure.
but just some simple, your thoughts on it, because it is a big topic.
Sure.
And not heavily understood, I feel. So take it away.
Yeah, sure. I think it's helpful to think back a couple hundred years, right?
Yes.
It would be, you would probably never have known anybody getting their wisdom teeth out 200 years ago. Granted, we didn't have local anesthetic 200 years ago. So it's almost like now that we do, right? Hey, we can numb things up. We can see things in 3-dimensional. They look a little weird. Let's pop them out, right?
Yes.
It's almost become this rite of passage. I had a woman ping me recently saying, she had a question about some, oral health things for her daughter because she was, now get this phrase, coming of age, or she was due for potentially these types of treatments. And I'm like, due for tooth extraction. Like, that's a weird way of thinking about it. But in our society, right? I'm 12 years old. Am I due for braces? And it's like, wait a minute now. This is a function of modern thinking, not of human anatomy and physiology. So to answer your question, there are absolutely situations in which wisdom teeth, for a lot of reasons that have to do with nutrition and how we've changed our, food choices and all this stuff, they may not have room for those wisdom teeth. So in certain cases, it's like, yeah, that's appropriate.
Yep.
Do I think that, every 18-year-old should just go down to the oral surgeon right before college or at winter break and line up to get them popped out just because you're 18? I don't believe that. I have 16 and 19-year-old daughters, and, my goal is like, let's let this ride, let's let your face grow and develop and see where those teeth are going to go. My 19-year-old is, appears to have wisdom teeth that are dropping into appropriate positions. And if so, we're going to just leave them there. They're in your head for a reason.
Right.
So that's my perspective. It's a case-by-case situation.
I love
But I do think that our society tends to think of it like, well, you're 18, it's covered by insurance. until you're 22. So we better do it. And it's like, oh, I don't know if that's a great reason to make health decisions just because your insurance covers it right now, but maybe not next year. So.
Well, I had my wisdom teeth out and I had huge cavitations for a while where I had actually this is gross, but I'd have to go in and pull a lot of food out of it.
Oh yeah.
And I can only imagine how much bacteria was in there. And then once they closed up, it was probably full of bacteria. And I have a really good friend who was in the health space and she was suffering with a lot of like eczema, stuff like that. And she definitely had histamine issues, which I talk about, but she also went to a biological dentist who said, you have a bunch of bacteria like in your, I guess it was in her gums or just somewhere in the tissue in her mouth. Okay. And he actually did a surgery and kind of cleaned everything out for her. And she felt so much better.
Oh, I can imagine. It's interesting in many of these chronic, long-standing infection issues, whether it's cavitations, root canals, those are the two most common that I see. It's interesting when I get the report back from DNA Connections, not all the time, but frequently parasites are the most, like there'll be a lot of bacteria too, but these parasites will be the highest level of microbe within this environment. And I just think, golly gee, we're thinking about all these other areas that we get microbes from. It's like, it's literally having a party in your mouth and you have no idea. Everybody, it's just being ignored. So hopefully through some, conversations like this, we can inform more and more people.
Yeah, for sure. And people think parasites only live in the gut, I guess.
Right.
Huh?
Yeah.
Nope.
Well, and it's funny, right? Because like, where's the gut start? In the mouth.
In the mouth.
So, when you've got an open wound, as you do when you have a wisdom tooth or any other tooth taken out for that matter, it's an open hole. And the problem is that if you are counting on your blood to clot up effectively, and which it can, right? It has the capacity to clot up well and provide a scaffolding, which will then create new bone and gum tissue. If that works, great, perfect. We're all happy. But so frequently, whether people are sipping on carbonated beverages, they're smoking or vaping, like you name it, right? They're eating Cheetos. Crap gets in there, it breaks down. Now you've got a big hole that's going to fill up with the stuff like you were sharing, Becky. And that's a recipe for disaster. One of the things that we have been doing for the last 4 years is anytime we do a surgery, if something comes out, something goes back in, and we use LPRF, which comes from your own blood. It's a concentration of your immune cells and your clotting factors, which we can stuff back in there, and it closes up the area. It provides a barrier made of your own cells, which has your own innate, immunity and energy to fight off anything that might want to come in. And my goodness, we have just seen such better healing as a result of that, as opposed to, the old days of using bone grafts and stuff like that.
I have a question.
Yeah.
What do you think about flossing with dental floss versus the Waterpik?
That's a good question. If I'm being totally honest, whatever a person will do in their mouth to keep things healthy and clean, I'm all for it, right? So I'm not like in any political camp of like, oh, you got a Waterpik, or you got to, no, it's all about flossing. Like, you know what? If you pull out the floss, even, every other day, I'm going to pat you on the back. Mm-hmm. If you find that the Waterpik works better for you, because in truth, different people have different situations in their mouth. Some have teeth that are super tight together, and Waterpik might not have as much effect there versus somebody who maybe they have had some bone and gum loss, and there's a lot of gapping between the teeth, where a Waterpik might be more effective to blast things out.
Yeah,
there are as many, great ways to do it as there are people. So we're just about figuring out like what's going to be the solution that works best for you.
Yeah.
But they both work.
See,
neither of them work if people don't use them. So
right.
Yeah, I had a dentist with a very strong opinion against the Waterpik recently, which I was surprised because my prior dentist was all for the Waterpik and made me get a Waterpik. And then this new dentist was like, don't get the Waterpik, use floss. And then he said, if you already have the Waterpik, fill it with peroxide, hydrogen peroxide, and use dental floss and then go in with the Waterpik with the hydrogen peroxide after.
So anything that sounds to me like dogma, I'm going to
Yes.
say, really? There's only one way? That just makes no sense.
Right. I'm like, I'm confused.
It's like saying that one diet is going to be the right way for every human being. And it's just
Right.
Exactly.
Exactly. I love that.
Okay. So the majority of, traditional dentists only give patients one option for treatment. Can you talk about some other options they may have for common routine procedures like a root canal or, et cetera?
Sure, sure. And I think the root canal is a great place to start, right? Because it is so common. Again, 15 plus million of these a year in the US alone. So the unfortunate part when a tooth is to the point where a dentist is saying the words, you need a root canal, usually that tooth is in a pretty bad state of affairs.
Yeah.
Now, I do want to clarify. I had mentioned earlier the situation where a person goes in, a tooth feels totally fine, but the dentist says there's a hole or whatever, there's a cavity. They drill it, they fill it. The dentist says it all looks fine, but the tooth hurts now, right? Usually there is an issue that can be resolved when a dentist's treatment causes sensitivity.
Okay.
Usually there's a way. It might be something where they didn't use anything over the dentin where the nerve is before bonding, whether that be ozone or a desensitizer, antimicrobial treatment of some sort. Usually we can go back, take it apart, treat the tooth respectfully, reseal everything up, and usually the sensitivity will go away. So sometimes when the dentist says you need a root canal, the nerve of the tooth might be able to get healthy again. So just know that, right? But let's say the tooth is dead or whatever reason where we go, yeah, okay, they're saying you need a root canal and that's the only option that they're giving you. The unfortunate part is if you don't do a root canal, your other option is take the tooth out. Now, I would argue that it makes quite a bit of sense to me to remove a source of chronic infection from your own living jawbone, right? And then the question is, well, I don't know how I feel about losing a tooth, particularly as we can imagine in our image conscious society, if it's a front tooth or if it's a tooth that's visible in your smile, that's kind of a big concern. So we have conversations around how might you want to replace the tooth, if you want to replace it at all. Again, I don't prescribe to any dogma. Just because you have a tooth out doesn't mean you have to replace it. Okay. There are certainly a lot of benefits to having your tooth back, whether that's removable appliances, whether that's a dental implant. But typically those are your options, right? You're either going to kill it with a root canal, fill it and wait for it to blow up on you. Typically that's what happens. Or might not blow up at all, and it might cause issues with your pancreas or your GI system or something like that. So the other option is to take it out, which is definitive, right? If you remove the source and you help the body to regenerate healthy bone, well, now the energetic balance and the nature of the health inside that bone becomes you and whole again. And I think if more people appreciated that and were informed of that, we probably see a lot more teeth getting extracted when they're that sick, as opposed to trying to mummify them when they're sick.
Right.
Yeah.
There's so many more questions we have. So I actually would love to have you back for a part 2 because we have so many more questions that we can't continue because we have another interview. But would you be willing to come back for a part 2?
Oh, absolutely.
Awesome.
We'll ask our audience what questions they have because I know there's going to be a lot of questions. So I think that we'll do a part 2 really soon. So can you tell everyone where they can find you?
Oh, yes. Thank you for asking. So my website is blodgettdentalcare.com. And I mean, I imagine you guys will have a link or something. But
we'll link it.
And on Instagram, it's at Blodgett Dental Care. We keep it very simple. I do the best of my ability to respond to people, but sometimes I get dozens of messages a day. And I do run I'm a full-time practitioner, along with all of the content that I write every week, where I'm telling patient stories of both what they experienced and how they got sick and how they healed by managing their oral health appropriately.
Yes. And Dr. Kelly really does do a good job, you guys, I see it. You respond to comments. You're so helpful. This is why I referred my family to you. I'm like, you guys have got to go see him, because he really is changing lives and really opening up the conversation and sharing. It just needs to be, talked about more, and people just don't know about it.
Right. Well,
I don't realize it all starts in your mouth, just like you said, like your digestive health all starts in your mouth. And something too that, you just said, people also don't realize that we're full-time doctors, and it's very hard to respond on Instagram. Yeah. And, we put out as much information as we can for free. We write articles, we do posts. Just make an appointment. Just make the consultation, and you can talk to them.
I will say it's interesting, we've really developed this concept of dental tourism. Think about how many people will save up money because they want to go to Disneyland, or they want to go to Yosemite, or they want to take a cruise, and they'll spend $10,000-$20,000. But the idea of spending, $1,000 to, fly to Portland and, see one of the best dental teams in the world seems foreign, but only because we have never considered it before. Once you consider, like, what kind of value do I place on my optimal health?
Right.
Do I want to, grow old taking medication to manage symptoms, or do I want to grow old thriving?
Exactly.
And we want to help people do the latter. And one last thing I would throw out to your audience, if I may, I am here to change the world of oral healthcare. I want to see this become something that people are, completely excited about pursuing. I want to help other dentists see the options that they have available to them, both in how they think about approaching patient care and interhuman connection, along with dental technology as well. And I need their help in spreading this message. So if they can, blast my, Instagram account out to as many people as they know, it would be so helpful in changing the landscape of this profession. I would sincerely appreciate that.
Yeah. And I just shared in my story that we are talking to today. So I always, encourage people to share what we share, to spread the word, because it really does start in your mouth. If you're sick and you've been working with even someone like us and you're not getting better, this is what we do. We refer people to people like you, because we're like, what, maybe it's in a place I can't get to. Yeah. And so we're just so appreciative that you came on, and we definitely are going to have a part 2. So you guys feel free to DM us on our Health Babes podcast Instagram, any questions you have for Dr. Kelly. And then I'll also put a question box up when we're about to interview him again. So thank you so much for coming on. And everybody leave a review if you liked this episode, and mention Dr. Kelly Blodgett, because we like to have people know what episodes would apply best to them. So thanks everyone for listening, and we hope you all have a great day.
Bye-bye.
Bye now.